Hello, good evening, everyone. Today we are going to have with us Dr. Sadeesh Niroshan, and he's going to share his experience about the FRCS Urology exam. He completed his part one in July this year, and then he completed his section two in November in one attempt. And he was associated with us in the part one course as well, and in the part two course as well. And he got through it in the first attempt. Presently, he's working as a senior clinical fellow in Christie NHS Foundation Trust. He's doing a Urooncology fellowship, and he completed his endourology fellowship from Portsmouth last year. So I welcome and congratulate you, Dr. Sadish, once again. Please share
Yeah,
your.
thank you very much, Dr. Ankit, and thank you for having me. As you very kindly mentioned, I'm actually a postgraduate trainee, originally coming from Sri Lanka, and I completed 1 year of endourology fellowship at Portsmouth, and currently I'm doing my second fellowship in urooncology in Christie. So I thought like,
So you moved to UK 2 years ago.
yes, this is my second year, to be honest. Yeah,
So again, congratulations. Now,
thank you so
I
much.
want to hear from you because you did it in first attempt, right? In your July section one, also in first attempt, section two, in also first attempt. That's a great deal. That's a great achievement.
Thank
So,
you.
could you tell us about your strategy? What has been your strategy for section one?
I mean, even in section one and section two, I would say for any exam, I have like a very simple strategy. I believe like it's not the depth of the knowledge that get through you through the exam. It is actually your performance to the level of the examiner's expectations. That is what get you through the exam. To deliver that, you should have an idea about the exam. Basically, when I start studying for an exam, I draw a sketch and create a boundary. Yeah. In this exam also, what I did was like I identify the important topics
Right.
and I then subdivided them into subtopics. And then as quickly as possible, rather than going deeply into the depth of each topic, I covered the breadth of the syllabus. Then once I laid my foundation, then I was able to like develop and dig deep and improve my knowledge on the depth of each subject. So that's what I did.
Very important thing because it's important that you have first a foundation of the entire subject and then you keep adding on it because you can keep adding on it till the last day before your exam. That addition can happen every time, but then you should have a very strong foundation to appear for it because this what I even realized for your section one, they are checking a lot on the basic principles, on the basic practice, everyday practice questions are being asked. So what was your experience about section one? Because I feel that it's okay to be going through the guidelines and the textbooks, but then how much did you find that the daily practice and the every clinical practice is being asked in the section one?
I would say like daily practice matters a lot. That's why this experience matters, because if you are like a trainee in UK, you will go through a couple of years. I would say at least 3 to 5 years of training. So when we are coming as a non-trainee, I believe like we should have at least couple of years, 3 to 4 years experience altogether before sitting for the exam, because guidelines matters, knowledge matters, but ultimately in the MCQ, they are asking for the single best answer, isn't it? So I would say sometimes you might find 2 or 3 answers are correct. So you have to select best out of them. So sometimes it is straight away from a guideline,
Yeah.
but sometimes if you have the experience of managing patients, then you know clinically what is the best solution for that particular patient. So that's why day-to-day practice really matters.
And did you find, because you're into a training post, you are into a fellowship, so did you find yourself at a more advantageous situation because you are more in touch with academics? Did you find yourself more at a benefit compared to someone who is more in advanced training or completed the.
To be honest, I believe so, because when I reflect on my marks, in certain sections, I have scored like very well.
Yeah.
So I think those sections are the ones that I am more comfortable with. Even in part one, it's the same. And even in part two, the Viva, it's the same. So I believe it's very important. And when you are like day to day practicing these things, you
Yeah.
see the exact exam scenarios as patients in the exam. In the part one and part two, I actually found couple of scenarios I can relate to my patients, exactly the same scenario. So that was not a surprise. So when I'm answering also, I have the confidence that I know how to manage this patient. rather than managing a question or scenario. It's managing a patient.
This is a very relatable thing that you said. Even when I talk to candidates who appear for the exam, they say that, yeah, I've seen this patient before. Yeah, this scenario is from my clinical patient. I've seen this patient. So it's
Exactly.
a very clinical exam. So yes, guidelines are important, but then they want to know what is the next best management, what is the next investigation. And that only comes if we have managed such a patient before, then such answers become easy job for you.
Yeah.
So you were into a fellowship post. How busy is your working schedule, and how did you manage time out of it? Because in a training post, definitely your work schedule must be quite busy. And
I had a very busy schedule, but it always like prioritizing your targets and also the confidence. As I mentioned earlier, for me, the best thing is like I will never lose my confidence, even though I go through a difficult period. So I would try to like keep on studying at least once a day.
yeah,
So
always keep in touch with the studies, however busy your
exactly.
day might be. So even suppose you're in a theater, you might get just 1 hour or maybe half an hour. Just keep in contact with your books so that some days you might be studying a couple of hours, some day you just might studying 15 minutes. But that staying in contact with academics is very important.
Yeah, and one thing to add to that. So when you are doing the day-to-day managing the patients, for an example, in the exam, definitely they will ask about the side effects, complications of surgeries. So when you are consenting the patients, try to do that in the practical way. I mean, provide them with the BOWS information leaflet. Discuss with them about the all the complications and side effects that you are going to discuss or repeat the same thing in the exams as well. So in that case, you don't have to like particularly allocate 1 to 2 hours per day, because when you are taking the consent, you would have covered couple of scenarios in your day-to-day practice.
Right, that's a very important thing because the consultants who are taking your exams, even they are expecting you to be talking like consultants. So they expect that you are using these leaflets and these principles of consenting every day in your practice. These are not something to be memorized. These are something to be reflexly present into your communication. When you're talking to your patient, you should be able to explain, okay, this is a grade 4 renal trauma. You should be able to explain what is the risk of failure of conservative management, what is the incidence of requirement of nephrectomy, how much is the success rate of an angioembolization. You should be able to know it because you are counseling these patients every day. That is what I believe.
I totally agree. Yeah.
What about your resources? Like, what would you say about the resources? Because many of the candidates who are appearing in May next year, they have 5 months or 4 months left exactly to study for the exam. What resources would you recommend for section 2 for them?
Yeah, so as I told you, like I try to keep my resources and the scope of work to a very minimum level, because I don't I know that I can't study everything.
Right.
So I studied 3 months for the part one and 3 months for the part two. That's my time frame. And for that, I stick to Donati books as well as your course. I would like to thank you for that course, because it basically provides you the boundary and also gives you an idea about the depth of the questions that they are asking, and you can have the same idea from the Donati.
Right.
And then I use these model MCQs, and there are like couple of circulating MCQ books. Then you can get an idea about what are the MCQs that can come to the part one. I mean, basically the areas of MCQs, areas of interest for the MCQs. Then when it comes to part two, as I told you, what I did was like first cover the breadth of the topic. For an example, if you take prostate cancer, if
Yeah.
you take prostate cancer screening, you can like start reading and to a level that ultimately you will be lost in a rabbit hole.
You can spend
So
1 week on screening of prostate.
exactly, about screening. But what I did was like I divided into like five simple topics like screening, localized prostate cancer, locally advanced prostate cancer, metastatic prostate cancer, and prostate cancer recurrence. Five
Right.
topics. Then I first completed that five topics. So I know that I have a like very good chance when they ask something about prostate cancer, about 70% chance that I have the knowledge to tell something. Then once I developed that foundation, then I went back to the screening and try to like develop the
Yeah.
depth. Yeah, yeah, that's what I did. Yeah.
That's a very important information because see, in an oncology station for section 2, it's a high probability that somebody is going to get a prostate cancer. So the candidates they prepare prostate cancer because they are
Yeah.
supposed to get prostate testis of penile cancer, and very unlikely that testis and penile is asked. Prostate is not asked at all. But then when with the high probability of prostate cancer, there's an equal probability that you can be asked a metastatic, equal probability of being asked in a localized, and as you said, in a screening prostate cancer or even a CRPC, anything can be asked. So giving equal importance to all the topics is the most important thing of preparation. Somebody who is just mastering the screening and some mastering the metastatic and not giving emphasis to radiotherapy, or so, for example, he knows everything about radical prostate, but he doesn't know about radiotherapy. That is also not a good thing to do. I think giving
Exactly.
equal importance, balancing everything is very important.
Yeah.
So how depth did you study the guidelines? Did you study the EAU guidelines, just the recommendations, or did you study in between the lines as well?
I first study the recommendations first because it gives an idea about the guidelines and what are the important things. And actually, I put a particular attention to NICE guidelines because it is the one that they are practicing in UK, and so it is very important for us to learn the NICE guideline. Particularly, for an example, when it comes to bladder cancer management, the
Yeah.
EAU follow-up and the NICE follow-up is completely different.
Right. For a
But
non-muscle
what
invasive
they
bladder cancer.
yeah, but they expect these nice guidelines. I studied like that. Once I started doing these kind of fractionated studying, I would say. So
Yeah.
it's very easy for you to like add certain things to that skeleton that you or the foundation that you have built. So once you cover the recommendations, it's easy for you to add couple of trials in between to prove those recommendations. Otherwise, like you will be studying all the trials and stuff, but nothing will remain in your head. Obviously, like it will never retain in my head. So
Right. So yeah, talking about trials. So see, in a Viva exam, it's always said that it's better that you quote trials where relevant. So how, in your practical exam that was held in November, how many references could you quote? Like, could you quote in all the stations or in some of the stations? Which station did you think is most easy or most absolutely necessary to quote the evidences?
I think in every station they expect us to quote some evidence except for the technology station, because depending on what you get, sometimes you don't have any evidence to tell. To be honest, in my part two, I actually caught a couple of evidence in each station, which gave me, I think, good marks. But it is not compulsory, and it is also very important to tell the reference. One thing is it should be correct, and I mean it should be true, and the other thing is it should be relevant. So if you like quoting something irrelevant, they will
Right.
pick you on that and then ask, and they will like make you realize yourself that it is not related to this scenario. So that is dangerous.
That's going to waste 1 minute or 2 minutes, and you cannot
Exactly.
waste
Yeah.
too many. Just on your mistake, you cannot waste a minute on the Viva, because every second, every minute matters in the Viva exam.
Yeah.
So, tell me more about your exam. Like, which station did you find most difficult, or which areas do you find requires extra effort? Like somebody who is appearing, is it very subjective? Does it depend on the personal preparation, or is it particular area is always difficult in the exam?
I think it is very subjective because when looking at my results, you may have those experience couple of years ago, but if you are not updated on certain area, for an example, to be honest, I haven't managed much of functional urological patients recently. So I knew that this is something that I'm lacking,
Yeah.
because this can actually, for an example, even pediatric urology, because I haven't managed pediatric urology patients with hypospadias or something like that, those conditions for a long time. So I knew that this is something that I'm lacking. So what I did was I put extra effort on studying the pediatric urology. I think it came really handy at the exam, because in the exam, the examiners were very impressed about the fact that I was like telling things very freely, and
Right.
ultimately it progressed very well. Definitely, there should be a weak area for each and every candidate, unless you are a brilliant candidate. So you should realize that. And if it is your weakness, you have to somehow practice those vivas by yourself, record yourself, and build up your confidence. So then there won't be any surprises at the exam. So that's my advice.
It's very well said that progressing freely is only possible when you practice well. It should seem like you are talking effortlessly. It should not the examiner feel that it's you're under stress, or it's obviously the examiners know you will be under some stress, but then your answers should be very confident, and it should be effortless. Like you're not trying hard to remember something. Like you're managing a patient, you should be knowing effortlessly the next step of management. So how do you think the practice helped? Like how frequently did you practice, and whether you had a study group, or We had, we'll talk about the course in a while, but then what was your preparation strategy and practice strategy?
I had a couple of study buddies. They helped a lot. And I think practicing helps because one thing is when you make a mistake, then you will learn from that. And of course, if someone makes a mistake in the group, it will also retain in your mind. So it's very important to practice among yourselves, but it is not right. Sometimes it will not be practical to practice every day. So what I used to do was like I made couple of hypothetical scenarios myself and then started answering them. For an
Yeah.
example, like I know like couple of subheadings. I told you like I have made couple of subheadings.
Yeah.
So I will make a scenario by myself for each that subheading and provide answers. It helps a lot. So practicing helps, but if you don't have a study buddy or you can't practice every day, the next option would be make up some scenarios by yourself and start answering. And of course, you can start recording yourself and listen to it.
Yes, that's very important. Practice is the only key for section two. And for section one, I think knowledge is the most important thing.
Yeah.
So you were talking about hypothetical situations that you would give to yourself, and you'll just challenge yourself with hypothetical situations. So we had a lot of hypothetical situations in our course also. We tried to, for example, in oncology, whatever sections we take up, how similar did you find those? What was the like? How were you satisfied with those hypothetical situations that we had, and how similar were to the actual exam?
I'm very well satisfied with those situations and the scenarios because, to be honest, I would say the most of the exam scenarios are similar, and that the scenarios that we were practicing helped a lot. And also, I think you might, I mean, English is not my first language,
Right.
so there are like deficiencies. So sometimes when you practice with by yourself or when you practice with your colleagues, sometimes the limitations of language or maybe the way of presenting yourself might not be picked up. But when in your course, I remember that you give advice to reduce the speed
Yeah.
and to emphasize on the certain words. So those advices improves our presentation abilities.
Right.
Because at the end, I believe like everyone has the knowledge when it comes to part two because everyone has got through part one. There are like two candidates. There can be like two candidates telling the same answer,
Right.
but the manner of presenting yourself, the manner of how confident you are is very well matters at the exam. Is very well come to play in the exam. So that's why it's important to follow your feedback in during your course. It helped me a lot.
I remember I was taking the mock exams, and this point was very well brought about by one of the candidates also. He said that he was giving mock exams everywhere, and he used to say that I give the same answer. My friend is giving the same answer, but I'm giving less marks, but my friend is getting more marks. Why is this happening? And when I say the answer, I'm getting in the feedback that you did not say this. And then I tell the examiner, I said this. This was the mock exam experience. Even when I was taking the mock exam, I told him, you did not say this to me. You should have added this in your Viva. Then he said, okay, I said it, but I did not. Maybe I did not appreciate it. So this is very important, that the way you emphasize particular things in your Viva is very important. You might have the knowledge, but if you speak in a very monotonous tone, the examiner have a tendency, they will miss out certain important things. They are also human beings, so it's not an AI based exam, it's a human being who is going to just mark you. So try to have a good voice modulation. Like for example, I really believe that the way you emphasize certain things, for everyone who is going to appear for the exam, they should learn to have some voice modulation. For example, if they have to emphasize particular investigation, try to emphasize it in a particular way that the examiner appreciates it. Examiner is convinced, then only you will get a mark. Otherwise, just saying it won't give you marks. The way
Yeah,
you say it matters a lot. So
exactly. I
about the
agree.
language, does the speed of Viva talking fluency, does it really matter? Because I don't think it matters a lot in marking. I think the
I would say it will not like change your mark drastically, but I always think about this part two as a job interview,
yeah,
interview for the first day consultant.
right,
So when two candidates coming with the same qualifications, and how are you going to mark or choose between two of them. So I think the your personality, your confidence and the speed and everything matters. I mean, it will not like change your mark from 5 to 6 or 5 to 7, but at least like it gives a good impression, even though you are making some mistakes, or not mistakes, like if you are like lagging behind, but still the examiner will try to like build up a conversation. And also you will also feel like more confident in building up the conversation when you have a good tone as well as good speed of speaking. That's what I believe.
How many mock exam did you give? Did you give a lot of mock exams, or what was your experience of mock?
So when you attend exam, then you get an idea where you stand, as well as compare to the others where you stand, and what are the things that you are lacking, and what are your strengths as well. So then you have a like kind of a baseline from which you can build up. So that's why mock exams are important. And other thing is, when you are being examined by one of your colleagues or friends, you
Right.
don't get that stress and that feeling of grilling. Yeah.
Right.
But when you have been examined by an external examiner,
Yes.
it's very important to be on the spotlight. And same thing happens during your course as well, because I have been in spotlight for many times in your course. So it actually helps me to like build up my confidence. And when I find find a difficult area or difficult question, how to tackle that. So it's very important.
Yeah, so difficult situation. I got reminded of certain things. So how do you deal with something which is unexpected? For example, you get a situation in exam. This is
Yeah,
any candidate who is going for 16 stations, one or two station might be totally unexpected, totally unprepared. This can
exactly.
happen
Yeah.
so
So
many
I completely agree with that, because like I told you, like we have for the part two, we have 8 tables. For me, I actually prepared for 9 tables. The ninth one is something that I have no clue about. If the examiner comes with
times.
something that they can catch me in surprise, because they might show an instrument I have never seen, or they might give you a kind of a CT findings or MRI that you will completely miss the diagnosis, or even for an example, a simple thing like very vague history of hematuria with a cystoscopy that you have never seen, or you are not sure about what is that lesion is. So what to do that?
Even if
So
you might have seen that time, you might not, it might not click into your mind.
yeah, exactly. Your brain goes into a complete freeze, and it is very normal to any one of us to happen. Yeah. So how to get out of it? So what I did was like I planned for that previously beforehand. So options I have. I was having either I can tell that I don't know and move on. I think it's also a better option, because it will not eat up your time with a complete silence. But
Right.
if you like go into a complete silence, it's not good.
Right.
So the other option is like when you are looking at, for an example, if you get an lesion in the cystoscope, which you are not sure in a patient coming with hematuria. So first thing anyway, you are thinking about is this is not a bladder cancer. So I don't know whether you will agree with this, but I would say rather than like keeping a complete silence to break the ice, I would say my first priority would be to exclude the possibility of transitional cell cancer in this patient coming with visible hematuria. But this cystoscopy finding is not compatible with, or this is not the typical appearance of a transitional cell cancer, something like that. So when you start speaking, then I mean, even
Right.
though you are keeping in the silence, you are thinking this is not transitional cell cancer, this is not the typical of a sandy patch of schistosomiasis, so this is not a squamous cell cancer. So what? So you can actually think aloud and use that thinking pattern to tell the examiner that you are rationalizing and excluding the possibility. That's what I was planning to do if it happened to me at the exam.
Even I, what I believe is during the course we were talking about certain mnemonics, like how to start the viva, how to
Yeah.
make opening gambit with our mnemonic. I think it's symptoms. Then we talk about the SARP, like the risk factors and the associated symptoms and the advanced disease. Like we had a mnemonic for this, and I think even if we, for example, they have given a scenario and don't know how to approach. For example, any scenario, very like we can get rectoperitoneal fibrosis or something like that, not very expected, not very prepared. So how do you start? You know something, you can start with the basics. Let the scenario create, let the whole thing
Exactly.
create, let they
Yeah.
give you certain information more.
Don't let that awkward silence build
uh,
up. So either break it with something, yeah, something kind of exclusion, or either if you don't know completely, just tell that it doesn't come to my mind at this point, or and move on. So otherwise, it will like completely make you more stressful. And
yeah.
the other thing is always prepared. Be prepared for this scenario because this can happen. That is the ninth table in the exam, the where you will get caught in surprise, complete surprise. Yeah.
So, what's your exam day suggestion? Yeah, these guys, they have the January section one, and
Yeah.
they have May section two. So, what's your
Yeah.
exam suggestion for them?
The thing is, like, from the undergraduate level we have gone through many exams, like, I mean, not only the undergraduate exams, postgraduate exams, local exams if you are from some other country, and you have gone through the MRCS and also the part one. So there's no doubt that you are compatible, you are good. I mean, there's no question about your knowledge. You have the knowledge as well as you have proven it. So don't lose your confidence. So in the exam, go with a very open mind and with a good confidence, and just perform there. And the other thing is, if one table goes wrong, or if you are not happy about your performance in one table, the next one is a new plate. So
Right.
you can start building up from the next one. So for an example, I don't believe, like, I mean, I believe it's very rare for a candidate to get a complete four
Yeah.
or a bad failure. So most of the time you are spending with a exam two examiners for like 20 minutes. So definitely you will be talking something. So I believe like most of the time it will be close to five. So
Yeah.
even though if you fail once one table, so if you can score two more tables, if you can score like seven, then of course you have compensated the that bad station. So it is very important. If something goes wrong, don't lose your confidence. Just keep on batting, and I'm sure that you will be able to cross the boundary.
Yeah, so keep on batting. This is very important. And being an open mind in the exam. Like, don't think I'm getting a scenario on hematuria. I will think about bladder cancer only. This could turn out to be an RCC. This could turn out
Exactly.
upper
Yeah.
tract cancer. This
Yeah.
happened to some of the candidates. Like, don't have a closed mind that a visible hematuria is always a bladder cancer scenario. This can turn
Yeah.
out anywhere. So keep your mind very open. You might get anything in anywhere. Okay, so don't expect we are not supposed to discuss scenarios, but then you can get anything anywhere. So be have a presence of mind, show the examiner that you are a safe surgeon. You know the basic approach of a patient irrespective of the symptoms that the patient is presenting. You know which symptom, how do you proceed, and what are the investigation getting, because I know candidates presenting with voiding LUTs with a elevated PSA, for example.
Exactly. Yeah,
They
it's a very common scenario. Yeah.
a very common scenario, and they don't say the LUTs evaluation. They think it's
Yeah.
a prostate station. I won't talk about the uroflammatory. I won't talk about the post-fire residual. I won't talk about the prostates. And so there's a problem. So we should be thinking of a patient as a whole rather than the station. Okay, so that's very.
Exactly. Yeah. Yeah.
So, any take-home message for them? Because you said a lot of things. Everybody's going to can relate this to them because they're on the preparation stage. You did both the sections in first attempt, so that's a big deal because not many people are able to achieve that. So definitely, you have some factor, an X factor that has to be communicated that everybody should understand. And I think by this interview, everybody's understanding that. There is something to be gained from this interview. So what do you think should they learn from you? Last thing, if they have to. Uh,
Yeah, so I think like the main thing is like you are competent, and any candidate who's sitting for the FRCS part two is competent,
yeah,
and so you just have to build up your confidence and not to lose it, and keep on. I mean, keep on fighting till you reach the end, and of course, your course helps. I need to stress that because it is somewhere that you can practice what you know and also put yourself into the test. That's important. And the other thing is having a good relationship with your colleagues, because they will ultimately help you, and help you can help each other. So I mean, uh, this exam has been cleared by many candidates. So it doesn't matter whether you fail to clear at one point, then I would say you have a better, you have an advantage compared to the other candidates, because you know the system of, you know the exam very well. Because for me, this is the first time, so I didn't have any prior experience. So now I'm like 200% confident. If I get another attempt, now I know the exam. So having a one or two failures is not a disadvantage, it is an advantage. And for the others, I would say, like, you should be able to do it, because believe in yourself, you have proven yourself up to this level. It is a matter of, like, keep the same face, and it's a kind of a discipline. So motivate yourself, find different ways to motivate yourself. Your course is one way, and the other thing is your friends, and also your own discipline to keep you motivated, and then complete it at the end. And I'm sure that everyone will be able to get through. And I
Yeah.
wish everyone
Really,
a
really,
very best.
that's a very important message that attempts doesn't matter. You might not be able to clear in first attempt like Dr. Sadish did, yeah, but it doesn't matter. Really, it doesn't matter if you're doing it second, third attempt. Nobody, the final diploma that you get doesn't have number of attempts in it.
Exactly.
Doesn't matter. Every attempt, every exam is going to teach you something, and you're going to be more wise compared to somebody who is clearing on first attempt. If somebody is clearing in multiple attempts, you get to learn more on during the
Exactly.
preparation. You have to enjoy the preparation journey. That's the whole thing. We are sharing the journeys of different candidates just to help you, so that you can relate to your journey to every doctor who is sharing his journey here, because there are fellows who are preparing definitely, so they can now relate that okay, this can be my story as well. So thank you, Dr. Sadish. Extremely thanks for your time, and for everything that you shared.
No
And
problem.
we
It's a
are
pleasure, and I'm really grateful to the way that you are preparing the candidates for the exam, because it is very concise and very focused, and it gives the candidates an idea about to which level that you should study, and also to which what are the most important areas that you should cover. So please keep it up, and it's a pleasure to have this opportunity.
Thank you.
Thank you.
Thank you so much. And we will stay connected because there will be students, there will be candidates who will be having questions, and I'll be acting as a channel. I'll communicate their questions to you, and definitely we'll have you again during the meetings as well, probably to help other students who are going to join the course. So thank you so much for your time. Wish you all the
Thank
best.
you. Thank you so much for having me. Wish you all the best. Thank you.